Biohacking is a very, very powerful word. But in medicine, the real question is not what can we hack, but what physiology are we actually changing and can we measure it? Everyone is talking about biohacking today. But most of it is really not hacking biology. It's just rebranding physiology or selling unproven shortcuts. This is what biohacking is most of the times. Well, today I'm going to tell you the difference or the framework between true biohacking and fake biohacking. So, if you ask me what is biohacking, biohacking is the use of data driven physiology based interventions to improve health, to improve performance, and to improve recovery. Biohacking is simply intentional biology modifications, but whether it is meaningful or not, it depends entirely on whether it is grounded in physiology and evidence. So the core principle remains that true biohacking is equal to measurable physiology plus evidence based intervention plus tracked outcomes, whereas fake biohacking is nothing but fashionable therapy, influencer marketing, vague claims, and no objective endpoints, really speaking. So, what exactly is true biohacking? Well, exercise physiology using CPET, VO2 max, AT, zone 2, strength training. That is true biohacking because it directly improves fitness, it improves insulin sensitivity, and it promotes longevity. Nutrition science, that's another biohacking principle or example because you use indirect calorimetry, you use protein targets, you use RQ guided plans and not just a equation derived parameter, and that makes it objective metabolic prescription, which again is biohacking. The other thing is sleep medicine. I mean, you look at sleep duration, look at apnea screening, circadian correction using a sleep study, and that has an extremely strong impact on metabolic and cardiovascular health. Body composition, DEXA, in body, visceral fat, muscle mass, these are measurable metabolic risks. This is something that is called as biohacking. Lifestyle medicine, exercise, nutrition, sleep, stress, social connection, these are established lifestyle medicine pillars. Then medical optimization using diabetes, looking at diabetes, obesity, lipids, BP, thyroid. That is disease risk modification and really not cosmetic wellness. And that's why if you don't guess, if you measure, if you prescribe, and you reassess, that is called as true biohacking. Now, let me tell you where there are certain things that might be conditionally biohacking. Now that's very interesting. What is this term conditional biohacking? It's not something that you will really tell patients that if you do this, this will occur, or you're changing biology. But with the right screening, right indication, consents, and outcomes, that I would call as maybe the yellow zone of biohacking. The ones that I told earlier, nutrition and VO2 max and stuff like that, were all the green zones. Anything different from that is I would call it as yellow zone biohacking. Well, HBOT, you see this very often in many places. That can be called as a yellow zone biohacking stuff because it's used for selected recovery. For example, if there's pain, if there's inflammation, or there are other approved indications like wound healing, that is going to change the biology to improve all of these things. For example, you just can't exercise. I mean, you get tired very soon, you are fatigued out very soon. At that time, maybe the HbO2 will improve mitochondrial efficiency, maybe it will improve angiogenesis, it will improve oxygen uptake, especially when you are peripherally delimitized. That means to say you just can't exercise, though your oxygen is consuming your oxygen, you're able to consume the oxygen, but it's not really working like the way the mitochondria should work. The mitochondria aren't really working like the way it should work, and that's why the oxygen is not being utilized that well. So at that time, if you were to use HbOT, that is after screening. That means you do a CPET, you figure your VO2 max, you find your anaerobic threshold, and then you apply HbOT. If the VO2 max is very, very low, or the 80 threshold is very very low, or you have peripheral delimitation, at that time using an HBOT is actual hacking the biosystem so that the mitochondria gets more and more efficient. Similarly, another system that we see in various places is cryotherapy, a beautiful system. It is a system for recovery. It is a system for perceived soreness. But however, it is not for weight loss or disease treatment. It is not for that. It is not for anti-aging. Whole body cryotherapy is not actually cleared for medical use. However, it is known to have a quick fix when it comes to soreness. For example, you run a marathon, you come over there, take your cryo, and you start feeling better. That is something that is called as a yellow zone biohacking, according to me. Now, what about photo biomodulation? Again, this is not anti-aging miracle. Remember this, but it is an adjunct for pain, an adjunct for recovery, and there are some scientific benefits for skin regeneration. What about IV micronutrients? Now, this is something that has been peddled time and again across places. Well, IV macronutrients should be given only when there's a deficiency, or it has to be indication guided. It can't be like the so-called immune drips that are used for marketing wellness spas. What about CGM in non-diabetics? Well, that is something you can use. CGM is continuous glucose monitoring. People are using it for diabetes, but it can be used for ethical biohacking, because if you put a CGM, you'll know the behavior of these patients, you'll know what's happening, you'll know when the glucose is going up, you'll know when the stress response are working. It might help in altering behavior and food habits. Microbiome testing, another extremely important thing that happens, and I still call it the yellow zone of biohacking because it is useful for nutrition discussion. It's not good to overclaim its precision, it's not extremely precise. In diagnosed deficiencies, it might help in certain levels, plus, it might also help in the event of irritable bowel syndromes and bowel riddle pathologies that are usually not treatable. In those cases, maybe an alteration of the gut diversity might do the trick over here. Another very big thing that is now happening all over in the biohacking zone is actually hormone therapy. Well, there is nothing you can do from hormone therapy that will actually make you age long. But in diagnosed deficiencies, there is a chance of using hormone therapy in order to optimize functions. So, endocrine society also, they require symptoms plus a consistently low testosterone, for example, for male hypogonadism diagnosis. That's why you need to diagnose the deficiency symptomatically, prove it in a lab, and then replace the hormones. Anything away from all of these things that I mentioned is actually very high risk hacking and also can be called as fake hacking. Thus, for me, true biohacking means using medical grade testing to identify what exactly is limiting your metabolism, what exactly is limiting your fitness, what exactly is limiting your recovery or your health span, and applying only those interventions that are physiological justified, evidence informed, and outcome tracked. Thank you very much.